Welcome to the Birth Squad, the podcast designed to empower birthing individuals with real insights from two Black female physicians. We're here to guide you through your health journey, one episode at a time. I'm Dr. Kamisha Thomas.
And I'm Dr. Ijalma Bello. We are two OBGYNs and longtime best friends, and we're here to help navigate you through the world of reproductive health.
Real women, real stories, real experts, and the facts you need to know.
Tune in every other Sunday, and don't forget to like, follow, and subscribe.
Ready to join the squad? Let's get into it. Welcome back to the Birth Squad, the podcast where pregnancy, delivery, and postpartum get the spotlight they deserve.
Yes, and today we're diving into a topic that can be overwhelming and emotional for many parents to be, which happens to be genetic screening comes back abnormal.
Yep, genetic screening can bring up a lot of questions. What does this result mean? Do I need more tests? What are my options? And most importantly, how do I make informed choices that are right for me?
On this episode, we're joined by a midwife who's not only guided patients through this process, but also has experienced it personally. She's here to walk us through what the process looks like, how to navigate these decisions, and why you are not alone in this.
Please be advised that this episode discusses sensitive topics related to prenatal screening and pregnancy outcomes, which may be triggering for some listeners. Listener discretion is advised. Well, welcome back, everyone, to another episode of the Birth Squad podcast. I am honored to introduce our next guest, who I've known for years. Laura is a midwife who actually trained me, and we went through the trenches at LA County together, and she has just such a wealth of knowledge. And so we would love for you to just introduce yourself and just tell us a little bit about who you are.
Yeah. So thank you, Dr. Thomas, or as I know you, Kamisha. So my name is Laura Uehara. I am a certified nurse midwife at Los Angeles General Medical Center, previously known as LAC USC Medical Center. And this is my story of kind of my process going through genetic testing.
So Laura, thank you again for coming. You know, one of the questions that we always ask on the Birth Squad for all our guests is, what was your path towards motherhood?
Yeah. So my path towards motherhood, I mean, everyone has their own long path, right? But mine was pretty much, I got pregnant at 33 with my first. I wasn't sure if I wanted to even have children before that. Made the decision to do it because, you know, I have a husband who's really caring and supportive, and that was really important to me because as a full-time working woman, it's really hard to balance and juggle all of the things. But at the time, that pregnancy went really smooth. I delivered at a birth center. And then for my second son, I was like, oh, this is going to be great. I'm advanced maternal age. I just turned 35. I remember being nervous, but I was like, I got this. Like, I've done this before. I showed up to my 13-week visit, and then kind of things were very different from that point on.
Can you tell us about that experience? Like, when did things start to shift? Kind of walk us through that experience.
Yeah. You know, I literally remember thinking, like, everyone calls it a geriatric pregnancy. I'm not geriatric. I'm just advanced maternal age, and I've got this. I got my NT ultrasound. I was very excited to see my son by ultrasound that day. And then immediately after, you know, when they're scanning, ultrasounds are so challenging, I think, for patients because we don't always know what to expect when we're a patient. As a provider, I know that when they ultrasound, they don't talk to you. And this might be from an ultrasound tech. Now, if you're a doctor or like for me, an advanced practice practitioner who's scanning, we kind of describe, we show pictures. But when you go in for a formal ultrasound, no one really talks to you. And the whole time we're sitting there really nervous and very scared, and we're hoping for something, you know, like it's going to be fine. Since I've been through it before with my first son, I was like, oh, it's fine. They don't talk to me. No big deal. And then when they stopped and they said, you know what, we need to go grab the doctor to come in. And I was at my perinatologist's office. I thought, well, that's not usually how it goes. You know, they came in and immediately the perinatologist was like, oh my gosh, your nuchal translucency from the ultrasound is thickened. So, you know, we need to do a procedure today to find out if your child's going to have Down syndrome or another anomaly. And I honestly was very shocked. I was not mentally prepared for that. I was like, I'm the girl who runs. I just did like a mud run in my pregnancy at 5 weeks. And so I was like, what do you mean it's abnormal? Like that doesn't happen to people like me. And so I was very nervous at that point.
Wow, what a difficult situation Laura experienced.
Yeah, seriously. And she brings up a lot of complicated topics. But don't worry, Birth Squad fam. We're here to break it down and describe some of what she talked about.
We should start by saying, There is so much information out there, and every state does things a little differently.
Yes, and it's important to keep in mind that genetic screening is optional, but it's commonly offered early in pregnancy. One of the most popular tests is the NIPT, or non-invasive prenatal testing. It's basically a blood test that's done as early as 10 weeks, and it analyzes the fetal DNA to screen for conditions like Down syndrome.
Then in the second trimester, there's AFP, which stands for alpha fetoprotein. That's usually done between 15 to 20 weeks, and it screens for open neural tube defects like spina bifida.
Now, alongside NIPT or AFP, some people are also offered something called an NT scan, or nuchal translucency scan, which is what Laura mentions. It's an ultrasound that's done between 11 and 14 weeks that measures the fluid at the back of the baby's neck. Increased fluid can be a marker for chromosomal issues.
That scan is typically performed by a perinatologist, also known as a maternal fetal medicine specialist. This is a doctor who specializes in high-risk pregnancies. Just being referred to one doesn't mean something's wrong. It means that your provider wants more information.
Exactly. And if your screening comes back abnormal or high risk, try to take a breath. It does not mean it is a diagnosis. It means that you have the option to do further testing, like a CVS, which stands for chorionic villus sampling, or an amniocentesis.
These are diagnostic tests. They give a clearer answer, but they do carry small risks. And the decision to move forward with them is completely up to you.
Now, we know that this is a lot, and that's why we're talking with a midwife today who's actually lived this experience both professionally and personally. So let's hear more about what Laura has to say.
So kind of walk us through what happened next. So the physician said, hey, we need to do this test today. So what actually happened? What decision did you make?
Yeah. So they said you're a provider, and I actually knew one of the perinatologists. So one of the doctors at the office I used to work with as a labor and delivery nurse. And so they were like, one of our docs, like you're, one of our people, like we could get you in today to do this procedure. It was too much. I was like, I don't know. And they're like, oh, well, if we do it today, by the way, like insurance may not cover it. And I was like, well, how much hold on, like you just told me there's something wrong with my child potentially. I'm very nervous about that. You're saying I need to get the test immediately because I was like right on the cusp. I want to say I was like between 13 and 6. Like there's a cutoff of when you can get the nuchal translucency done. And I was like right there at like 13 and 4. So like, well, we got to get it in. We got to get it done. And so we should do it as soon as possible. And if you can't do it today, then we should do it next week. And the doctor's speaking at such an urgency for me that I already kind of felt like there's something wrong with my child. Like there must be something wrong with my child because of how you're speaking with me. So I've been doing a lot of like life coaching, and a lot of people I listen to talk about a survival brain, and then they talk about our prefrontal cortex. And I believe that when our survival brain turns on, that it's very hard for us to think in prefrontal cortex, which is like long-term thinking. So when survival brain turns on, it's like, oh my gosh, we're in danger. I got to fight. I got to flee. Or I got to pause, right? I'm going to freeze. And if I freeze, nothing will happen. But in this case, I was like, I know prefrontal cortex knows there's not an emergency here. Everything is okay. We need more data points. My survival brain was definitely turned on. Like, I'm not okay. This is not okay. You're speaking to me. My husband's not even here. I'm not sure if I'm ready to do the procedure. Even if I say yes, you said you're not going to cover it. You can't tell me how much it is. And, and he was like, maybe it's between $1,000 to $2,000. And I was like, I need that covered. Like, I'm sorry, I'm a working mom who's about to have a second child. Like, if it can be covered by insurance, I think I need to have that covered. And by saying that, to be totally honest, I felt really shamed. Because it was like, oh, so you're going to choose, and he never said this, but this was my own brain. And its thoughts was like, oh, so you're going to choose to wait for this very urgent test because you want to like have it covered for by insurance. And honestly, I was like, yeah, I need to wait. Like I will have to come back next week. So to jump forward, the procedure they're asking if I wanted to do, which I knew I did, was CVS, known as chorionic villus sampling. And so that is very similar to like an amniocentesis, except it's done earlier in pregnancy and they can do it transvaginal. And so to do the procedure, some might say like it's kind of invasive because you can get a speculum put in and then they go through your cervix and then they visualize and they take a sample of the cells. So I was like not in the mindset to do it that day. And I'm glad that I was able to give myself opportunity to go the next week and bring my partner in and talk. But I mean, I was very caught off guard by the nature of having to talk immediately about how much things cost.
My gosh, what a difficult,
Yeah.
right? So how did you explain it to your husband? Like, what did that conversation look like?
That's a great question. So talking to my husband, he was like, everything's fine. Don't worry about it. Baby's fine. Um, Honestly, I got most of the support from people at work and talking to them. And at our workplace, actually, we weren't doing nuchal translucency testing for our patients because we would just go and do the amniocentesis. So that's something that was not offered at our site. So it was kind of like everyone's like, what are you talking about? Right? Like, why is this happening so early? Like, this isn't a conversation until later in the pregnancy, which also was very interesting to have. I got the CVS done the next week. My husband comes with me. I think the weirdest thing in getting that procedure done for anyone who's listening is that when you are able to look at the ultrasound and see like, oh my God, they're like sticking something through the amniotic sac and grabbing samples of it. It was painless. There was no vaginal bleeding. I didn't miscarry. And so the procedure was fine. It's just, it was kind of eerie in the fact I was like, oh, this is like, there's so many things that we do in obstetrics that's an everyday thing that sometimes even as a healthcare provider working in obstetrics, like, oh, this is just another day. Like I do, so many of these a day. But when you are that patient and you're laying there flat watching on the screen thinking, God, I hope I don't miscarry, like I hope I don't go home and bleed. And, cerebral brain saying that, and the prefrontal cortex is like, girl, we got this. Like you got good professionals, like you got some of the best doctors in Los Angeles working on you. Like, don't even worry. But still that survival brain comes in, and I appreciate the midwives that I were seeing because they really held my hand every single detail, every single time. And I'd come in crying and they were just like, it's going to be okay. We've got you. I chose to deliver with midwives at a birth center, and they really worked really hard to get all of the stuff approved. So the CVS by the following week was approved by the insurance to have it done. But one of the questions that the perinatologist had was like, I don't know if they can get our stuff in time for insurance to cover it and how quickly that will happen. They said, once we get the sample from the CVS, then we have to send it for testing.
Yeah. So what kind of happened next? So you're kind of figuring out, is insurance going to cover this or not? You're trying to get this tested. How did you navigate? Like what was happening?
Yeah. So the center puts you with a genetic counselor and they sit you down and they do genetic counseling. But there's some sort of disconnect, I think, that happens at a lot of genetic counseling visits. She's going through my family history and all of that portion. But in the midst of I was like, I want all the testing done. Like he's got the sample, test everything. And the first thing from the counselor was like, well, we're not going to do that. And I was like, why wouldn't you do that? Just test it all. Like, I don't know why this is a problem. Just whatever you need to test for, test for. And she said, well, I don't know about your insurance, but most of insurances will not cover until the test comes back positive. And then if that comes back negative, you don't need any other testing. And I was like, but there's other things that can cause, like when you look up reasons that NT ultrasounds are abnormal, one of them could be this thing called Noonan syndrome. And so I was like, I'd like for you to just test for Noonan syndrome because the quality of life for someone who has Noonan syndrome is very debilitating. And so I knew I would want choices if that were to come back positive. And I wouldn't want to find out later, depending on what the recommendations are for abnormal NT ultrasound at the time, is to also get a fetal echo done. That fetal echo would not be offered to me until the baby's between 20 to 22 weeks. When it was actually scheduled was 22 weeks at CHLA, which is Children's Hospital of Los Angeles. So I was like, so when that comes back abnormal, then you're going to re-offer me an amniocentesis because my CVS cells that are sent are only available for like 4 weeks. And so I was like, by the time you get the results for everything else, or if any of the other testing that comes back, then my cells will no longer be valid. So then I'm going to have to do an amniocentesis. And to be perfectly honest, I don't want to be poked again. So I basically every single day called the insurance to get a microarray assay approved. So they said, NIPT comes back. If it's negative, then we will send the microassay. And when that's negative, then we'll send a Noonan. And I was like, I will miss the window. Send at least, I was like, fine. If you're not going to send all of them together, which she refused to do, then I was like, please just send the microarray with the Noonan. They wouldn't do it. And so my NIPT came back negative. That's when they said they would send a microarray, at which point then I literally worked every single day for, I think, about 2 weeks trying to get it approved with insurance. Meanwhile, I'm going to work and I'm seeing Kamisha or Dr. Thomas, and I'm pretty much in tears a lot. And I'm complaining about how difficult this is and how it's just not covered. And the crazy thing is, one of the residents I worked with, she actually had an abnormal NT, and her MFM, she's like, I want it all done. When she did her testing, and guess what? She got it all done. The doctor said, yep. The other part that kills me is that I would call the genetic counselor hotline. And I got someone from Arizona one day, and she was like, if she wants to approve it, she can just send it. And I was like, so you're telling me my genetic counselor can just send it? She can just make a decision and send it, but she won't, because of like her philosophy that everything's got to come back negative. And I think that was a portion of like the subtle things in practice that makes it so unnerving. And the doctor who I know from the office, I didn't want to be like bothersome to him, right? So I actually didn't ask him for his help during the time that I was going through all this, because I was like crying. I didn't want to be like that person who's always emotional and can't handle herself. So I didn't reach out to him. But at the end of all of this, I actually reached out to him. He's like, I would have written you a letter. Like, that would have been no problem. And I was like, oh my God, like that, maybe that could have been because he's the doctor working. He's like, I had no idea that our genetic counselors were making it this difficult for these things to get approved. And that's the part where I was like, because I could have saved myself just a little bit of trouble. But I bring that up here today because then this sounds like maybe it's a little bit more subjective, or maybe we need to have more of a discussion about like what our philosophies are when we work with the insurance companies, and like how insurance companies should be approaching patients, because it doesn't always have to be this difficult. This was my story, but I hope no one else has to go through this.
Wow. We just want to take a moment to thank Laura for sharing a very difficult subject and a very difficult time in her life. Pregnancy can be anxiety-inducing for anyone. We hope that by sharing these stories, we can empower you to get support and advocate for yourself. But we know it can be hard.
We also want to provide you with more information about some of the diagnostic tests that she mentions. Earlier, we mentioned CVS and amniocentesis as follow-up tests if a screening comes back abnormal. So let's break down exactly what they are.
As we mentioned, CVS stands for chorionic villus sampling, and it's usually done between 10 to 13 weeks. It involves taking a small sample of the placenta, which contains the same genetic material as the baby. This can be done transvaginally, and this is what Laura had.
Then there's amniocentesis, which happens a little later in the pregnancy, usually between 15 and 20 weeks. This test takes a small amount of the amniotic fluid, which has the fetal cells that can then be analyzed. These cells are collected by going through the abdominal wall.
Both tests are diagnostic. This means that they can confirm whether a baby actually has a chromosomal condition like Down syndrome, or trisomy 18, trisomy 13, and other conditions that we're looking for, not just the risk.
The samples can also be used for something called a microarray, which is actually a more detailed test that looks for tiny missing or extra pieces of chromosome, which are called microdeletions or microduplications.
And this is where things like Noonan syndrome can sometimes come up. Noonan syndrome is a genetic condition that affects development in many different ways. Things like heart defects, short stature, unique facial features, and sometimes even learning differences.
And Noonan syndrome can be inherited or just happen to occur spontaneously. And it isn't always picked up on the basic genetic screening, but a microarray may detect these changes associated with it.
So the big picture here is CVS and amnio give you clearer answers than screening alone. And with microarray, you are getting even closer look at the baby's genetic blueprint.
And just like we've said before, these are all just tools to help you make informed decisions. You're not just collecting data for the sake of it. You're gathering information that may guide your care, your support team, and your peace of mind.
Exactly. And you always have a choice. These tests are offered, not required. And what you do with the results is deeply personal.
And finally, don't forget that your birth team, whether it's your doula, your midwife, your doctor, we're all here to help you. So if you're struggling with something like insurance, you should speak up and see how your team can best support you. Now let's hear how Laura's story ends.
Laura, wow. I mean, just to have the stress of going through this process and then also feeling like you're racing against a clock and fighting, it seems like on all different, like multiple battles. I'm so sorry that you went through this. It's remarkable for you to be able to talk about it, with so much conviction and be able to share it. So I really do appreciate and, for letting us know about all this that happened. And I think, you bring up a good point that like there are various experiences within the healthcare system. And, there's variation in practitioner practices, right? Their protocols or the way that they were trained about this, then that. And sometimes some people are more stringent, right, in terms of like what they're willing to bend and mold towards, right? And then we also factor in insurance, which, as we know recently from the headlines, that sometimes they do not have our best interest at heart, and people actually suffer as a result of that. So I think you just bring up a lot of, important topics relating to the healthcare system and how that can really affect the person, the patient, the human, like even you in that same field was really suffering through this and trying to navigate it with so much difficulty.
Yeah, I appreciate you validating and acknowledging the challenges even as a provider, because it is hard to talk about it, especially as a healthcare provider, because I don't want to put anyone down, but I do want to point out where some of our biases can sometimes be. Sometimes individuals in healthcare, we need to paradigm shift away from something that we thought was or is and be more open to like, oh, like if that genetic counselor had just been like, oh, you know what? I've never had someone be so persistent on wanting to get this done. And like, I want to help you out. And maybe I can just talk to my MFM, my perinatologist today, so that we can discuss this. On the very first day when they did my CVS sample, I would have not had all of this other issues. Like it would have just all been sent. And if it was like, no, we're going to do the NIPT and then we'll wait. But like he could write a letter so we can get the microarray and the Noonan test done. That I will handle that. Instead, the response was, you're going to have to figure this out with your insurance. I really can't help you with it. I'm sorry. And I was like, okay, well, I'm a healthcare provider, so I will like do whatever I got to do to figure out these things. But I don't know that we should make it that difficult for individuals. And I actually think in healthcare, we need a lot more like how we have doulas for labor and delivery, like people to help advocate through the healthcare system. The crazy part is I got a letter in October after I had my kid the following year saying that I owed $1,600 for my NIPT test. And I dealt with that for many a months as well. And I was just like, my kid is like almost a year old, or at that point, a year. And I'm like, and here I am again, like already had to do all of the stuff for the insurance approvals, had the baby, and it still hasn't ended. So that was pretty upsetting as well.
I mean, I can't even like you say like you came into work and you were like crying. I feel like you were so stoic. Like I knew something was going on. I was, like we had talked about it a little bit, but I feel like you came to work and you still like held space for other moms, and like still did an amazing job like you always do at work. So the fact that you were going through all this and we're still managing to not only do your job really well, but be a mom and a wife, like that's amazing. And I think you deserve so much credit for that. What do you feel like helped you? You mentioned your midwives kind of helped you. What else do you think helped you to have like that type of like fortitude to be able to navigate this uncertainty and the waiting period that was involved in trying to figure out the diagnosis?
Yeah, that's a great question as well. I think having honestly like working with residents, I would come in and I would talk to you guys, and then I would, like you said, do my job, and then I'd take a break and go into the break area, and I'd basically make a call to the insurance company during business hours before they closed, trying to get more results and see where things were. And then I come back out and I would complain honestly a lot to you guys. And when all of the OB team, the residents, the faculty, the other MFM, which is the maternal fetal medicine specialists who are the fellows in training, I would talk to them about it as well. And they were like, Laura, it's going to be fine. And I was like, how do you know it's going to be fine? And they're like, Noonan syndrome? Like nobody has that really. The percentage is so low. Like you're going to be okay. It's like less than 1% chance. So like, let's go with the like 99% that you're there. If you were going to go to Vegas, wouldn't you want to bet on the 99 and not the 1? And I was like, but when you're the 1, like, you don't want to be the 1%, right? And I just want to make sure I'm not that 1% because I want choices going forward. And so that was really helpful. And it taught me a lesson in giving reassurance to people, even when we can't. And there's this idea out there that I'm learning from actually a parenting person that talks about sturdy leadership and having the reassurance that we can give people that even if things aren't okay, that other people can borrow our confidence. And previously in healthcare, I used to actually think that was like when people be like, you're going to be okay, you're like, you can't guarantee she's not going to hemorrhage. You can't guarantee this is not going to be a tough delivery. Like, I'm not going to say that to someone. I am not going to give them false hope. That's the way I was raised and kind of like the message I would give. And I actually have changed my messaging and communication now to really give people that sturdy leadership that no matter what happens, that I can be as strong of a leader as I can. I can go ahead and steer this boat as best as possible so that you can borrow confidence from me when you need it. And so that's how I'm parenting now. That's how I'm trying to show up as a midwife at work. And like, even with my partner, he's at the fires currently because he works for LA County Fire. Yeah. And my son said, why does daddy always have to go to the fires? And why does he show up when danger happens? Right. And he's like, how do you know? And he's like, is he going to be okay? And I said, daddy will be okay. And he's like, but how do you know? How can you promise that to me? And I was like, because daddy, I trust daddy. Daddy does the best he can to stay safe. So I know that daddy's going to do the best he can. So I can promise that to you. And I think before, even my experience definitely with this scenario we're talking about with my second child, I couldn't have said that. I was like, you don't know that. I can't say that to somebody else. Like, I can't guarantee that things are going to be okay. I can't guarantee he's going to make it home. I can't guarantee any of this. So I'm just going to say, we'll do the best we can. But having that little bit of like faltering, like the best we can, it doesn't sound as definitive as like, I know that dad will do, the best he can, genuinely, like, to be safe. And I promise you that that will happen. Even if it doesn't happen, it allows for my kid to borrow my confidence. And that's what my MFM fellows said to me. Like, you can borrow our confidence, Laura, that this is very rare. It's going to be okay. And even though you don't feel that way, carry this hope with you. And that was a lot. So I would definitely say for anyone else out there as a healthcare provider who is afraid of all the bad things that happens, and that's how we're trained, is to be afraid of it and to make sure informed consent that the patients know of all the bad things. I think we need to also carry with us like that we are trained. We're very good at what we do. We don't want anyone to get hurt, and that we are going to give that kind of care and give that kind of confidence to the patients as well. Because when we show up being like, yeah, you could die, but like, we just have to have you sign this consent. Like, no, like, I need to have this consent signed. It does say that this is a risk factor. However, I am going to do everything in my power to make sure that never happens. And you can borrow confidence from me that I got you, right? And I could have never done that before. But now I offer that because I will always do everything I can, right? Like, this is not a lie. So yeah, so that's what gave me fortitude.
Yeah, what great insights that you gained and, new skills and perspective that you've been able to carry on into your personal and professional life. So I wanted you to kind of go back to, the results. So you got everything done. They ultimately did send for Noonan syndrome. So what actually happened?
Yeah. So NIPT, non-invasive perinatal testing, which looks for Down syndrome, came back negative. They sent the microassay, which then I believe took about 2 weeks to come back. That came back negative. And then Noonan syndrome, they sent at the last week before the cells would not be usable. And that came back negative. And then I did the fetal echo, and that came back negative. And finally, at 22 weeks of the pregnancy, I could feel like I was going to just continue on and be, happy that I could continue on the pregnancy. But I will say the other thing I learned out of it was like the emotional disconnect that people have for that first part of the pregnancy, and then anxiety and how that impacts mental health as well. Because it was very hard to then even connect to my baby at 22 weeks because I thought I wasn't going to have him possibly those 22 weeks before. So, that was interesting.
What advice would you give to someone who's in a similar situation, or to friends and family of someone who is going through something similar to you?
Yeah, I would definitely recommend for friends and family to just listen, being really supportive. How can I help you? I actually would bring all these papers with me because at the time my mom got me a pass to Disneyland, and We would take my 3-year-old, and I literally would have stack like this thick of just legal pads of things I had been writing down and I had taken with me. And I was like going through with my mom, flipping through, like, these are all the things that could happen that were bad. And she just time and time again, people were like, I know you're really focused on like what could go wrong, but like, let's try to focus on what is okay and what is right, and kind of that reframing. But I was in the mode of like, how do I solve this? And so sometimes when we're in that, it's just helpful for friends and family to reframe, right? Coworkers, colleagues, of like, you're okay. You're a very healthy person. You're going to be okay. It's going to be okay. It's going to be okay. And just hand holding.
Is there anything else that you wanted to share with our listeners? You've already provided so much, perspective and insights, and I really appreciate everything that you've shared, your vulnerability. But if there's any last words or things that you wanted to just make sure people heard.
I actually want to hear from you guys as providers. Like, how does this impact you for your story and kind of your care or things that you've seen?
Yeah, I think I can speak to that first. I think genetic anomalies don't happen often. Like all the other MFMs were saying, it's not the majority of our patients, right? It's the minority. And I think my perspective and my approach is, let me advocate for you as well, right? So a lot of times what happens is we'll get the results. I'm like, I'm going to schedule an appointment to talk to them immediately. And then I'm like, what do you want to do? Like, we can do A, B, C, D. And then I'm working with my staff to figure out how quickly can I get them scheduled so we can get answers so they can make a decision. And the other piece of that is, I am always quick to say, I will support you no matter what you decide. Like, I'm not here to judge you for whatever decision you make. This is your life. You have to do what's right for you and your family. And I try to make sure that the team that surrounds that patient shares that belief, that model, because some people feel uncomfortable. Like, we're talking terminations, right? And, maybe anesthesia feels a certain way. Maybe a scrub tech feels a certain way. So I'm like, I give people a space, like, this is what's going on. This is what's happening. If you're uncomfortable, please let me know. Because I don't ever want a patient to feel uncomfortable with the decision that they're making. As providers, I see it as my role to advocate for you, to make sure you get what you need so you can get the answers so that we can act as soon as possible.
And I would say, for me, as someone who was previously practicing in California and is now in Georgia, there's been such a shift in how I can best support my patients who are going through, things like this, because the options are not necessarily all there for them in terms of, termination or deciding to proceed with the pregnancy. So at least from my perspective, it really trying to meet the person where they are, right? There are some patients that, like, I'm seeing every week, and we know that at some point there's going to be an intrauterine fetal demise because of the genetic abnormality. But just holding space for them, I also been in deliveries where we knew that the baby would die right after delivery. And so again, holding space, like checking in on them really. And, everyone deals with these types of things differently. Their insights are totally, individualized. I have some people that, despite the diagnosis, they're hopeful that, things are going to be okay. It's going to be fine. And there's others that are like, just know what the end is and are really just, reacting in that way. So it's been an interesting journey, actually. And I think as a provider, like Kamisha said, it's advocating when you can, right? Whether it be like in the delivery room where this baby is demised, like having the nursing staff or whoever being very supportive, how to wrap the baby so that they can hold that baby during that time, giving them the time that they need. Our jobs are hard. People go through really hard things. Pregnancy is not always like, roses and butterflies. There's, we also see this like these hard parts that people have to navigate.
I appreciate both of you sharing that, because mine was a happy story. I have a healthy 5-year-old. He's doing great. But I mean, and that's probably where my doomsday came from, because I worked in labor and delivery. The first person who I actually, as a student nurse, that I was in a room for was a stillbirth delivery when I was a student. And I was like, oh, and I was like, I actually want to go into this to support those individuals who have to deal with one of the most difficult things that they will ever have to deal with in their life. I feel like a lot of people don't like to talk about that, obviously, in pregnancy and birth, but I think it's really important for women to be able to share it and to know they're not alone, right? Like, it's really rare when it happens, and it doesn't happen often, but you are not alone. and that like hopefully everyone out there who hears this can feel really well supported to find physicians, providers that are similar to you guys, or maybe find you all there, because we really do need women, men, families, all individuals to feel supported with a pregnancy as a pregnant person.
Amazing. Thank you so much, Laura. Is there any way that the listeners can get in contact with you? Is there anything else you want to share with listeners as we close out the episode?
So I work at LA County General Medical Center. So we do have a family planning clinic that is always open. We're based in California, right? So we have FPAC that's able to see patients that need support for reproductive needs. And at LA General Medical Center, we serve the underserved population of Los Angeles. So unfortunately, if someone sees me and is like, I want her as my midwife, we do have very strict criteria of who we're able to see. But definitely there is a website that you can visit to see who the California nurse midwives are, and be able to, find a midwife for yourself. So it's been a pleasure.
So that's it for today's episode. If you take one thing with you, let it be this. Facing uncertainty in pregnancy is tough, but you don't have to do it alone.
Thanks to our guest, Laura, for sharing such a powerful story. Knowledge, support, and self-compassion really do go a long way.
To connect with Laura, you can find her at Declutter Freedom on Instagram or on YouTube at Declutter Freedom, where she shares simple ways to declutter your home and your mind.
Thanks for listening, squad. And remember, be kind to yourself. We'll see you next time.